Welcome to the University of Michigan Dentistry podcast series, promoting oral health care worldwide.
The University of Michigan School of Dentistry presents Achievements in the Pilot Program of Dentistry. Previously, the University of Michigan School of Dentistry demonstrated how various media formats are used in designing an individualized dental curriculum. This presentation will describe some of the subsequent achievements which have been made toward developing an individualized dental curriculum. We'll focus upon the factors influencing the decisions that were made and how those decisions were carried out. These points will be discussed by the faculty and instructional specialists who designed and developed the materials. 3 areas of instructional development of each course will be discussed. These are defining instructional objectives, designing and developing materials, and testing the effectiveness of materials and revising them to meet standards of excellence. The first step in developing individualized materials is to establish instructional objectives. Course objectives are not simple restatements of course content. They're carefully conceived statements which define in behavioral terms desired student learning for individual modules of a course. Therefore, objectives are established by asking the questions, what should the student be able to do and under what conditions? How will the student demonstrate mastery of the material? And what will be the required level of performance? Secondly, the preparation of the criterion measure or test to judge whether the prepared materials effectively teaches the student the information needed for successful completion of the course. When evidence is found to indicate that students meet acceptable levels of performance on the criterion measure, materials are said to be valid. This is the acid test in instructional development. The value of instructional materials is dependent upon their effectiveness in producing the required student learning. Therefore, during validation stage, it is important to assess all of the elements of the prepared materials. Finally, production of the material. It is important to design and develop instructional ideas in the most effective, creative, and practical media format. Guidelines have been established to help select the appropriate medium for dissemination. The first course we'll present is Clinical Complete Denture Prosthodontics. The knowledge and skills acquired in the preclinical course are built upon by students as they treat a patient in the clinic. In the preclinical course, the students receive their first exposure to the clinical and laboratory procedures in complete denture construction. Throughout the preclinical and clinical experiences, a procedural manual is used in conjunction with instructional television programs to individualize the course. Dr. Brian Lang explains.
Well, the faculty members of the Complete Denture Department began several years ago to write objectives, and they asked themselves the question, what should a graduating dentist from the University of Michigan be able to do in providing services and treatment for patients who are edentulous? And they were interested in writing succinct statements that were relevant statements as to the management of a particular patient. Once they had written these statements, they began to organize them into a series of courses and use those objectives to structure the course. Some objectives dealt specifically with didactic elements of the curriculum, and others with manual skills, manipulative skills, performance exercises.
These objectives then, why were they changed changed and designed to meet the student's clinical experience?
Well, let me give you some examples. For instance, in the structuring of our preclinical course, as most preclinical courses, we used a mannequin. In the various phases of constructing a complete denture. The students' reaction to the use of a mannequin was quite different than perhaps we've had in previous years. They felt that the relevancy of a lifeless object in using different materials and tray construction and these types of things didn't really relate to what the student would be doing in a clinical environment. So when we began to have these objectives and to write a procedural manual and using the various audiovisual aids and materials, we were using the mannequin. The students felt that why not switch this and show the same types of things using an actual patient. Our staff felt this was a very realistic change. It didn't alter our objectives. It just altered the method that we used to fulfill the objective.
Okay, so all the media presentations demonstrate these things on an actual patient then?
Yes, for the most part on an actual patient. We take an actual laboratory exercise and we take it through its first initial phases up to the point where it would be used on a patient, and then we demonstrate through the, in this instance, the videotape materials and media, how we're going to use it on an actual patient.
Just gently heat the compound. Again, tempering the compound in this water bath, which is approximately 130 to 135 degrees Fahrenheit. We can return to the patient. Very carefully, open please. Insert the tray, position it up, holding the tray, grasp the lip, massage the lip down and forward. You might also pinch the lip up and just gently massage it from the exterior. This permits you to develop the appropriate length. Here you can see we've extended the labial flange both in length and in the appropriate thickness.
Well, the basis for each procedure are criteria sheets in the manual. Is this correct?
Yes. Now let me give you an example of how the criteria sheets apply. You might, for instance, in one of the early courses in the curriculum, have an objective which requires decision-making on the part of the student. You may also have an objective which requires a performance. For instance, we talk a little bit about articulation and the factors involved in articulation, one of which is the wax occlusal rim. The student should have a knowledge of the importance of the wax occlusal rim, but he also should understand how to establish a tentative wax occlusal rim. This requires some manipulative skill on his part. But the thing that's most difficult, I think, is when you talk about these things, if you talk in terms of subjective interpretation of what the rim should look like, it's very confusing to the student. So we established criteria sheet. Let me give you an example of a criteria sheet and how we use this sheet in discussing with the student those things that the wax occlusal rim should possess. And we try to quantitate them. For instance, we say that each student should complete the preparation of the wax occlusal rim before seeking the assistance of the instructor. And he should say, and he should notice on his rim, its position. It should be in the middle third of the impression tray. It should be 1 to 2 millimeters below the top of the retromolar pad. It should be flat. However, the width of the rim should be 7 to 10 millimeters. So you see, we quantitate things, and then the student can take the ruler, he can examine the rim. Yes, it is, or it is not fulfilling the criteria, as opposed to just saying it is too wide or too narrow.
How about validation of this material?
Well, in the area of validation, what we did was to start with a group of students who were involved in the individualized concept, who used the manual and the various visual aid materials, and actually went through the course at their own pace. We had another large group of students who followed the lockstep traditional method, and we tried to control as many of the variables as possible. Then each group performed by producing a product using a performance skill. And then using a double-blind study, we evaluated the product. And what we found, interestingly, was that in both situations, the product was acceptable, and in 2 out of 3 tests, different examinations that we gave the students, the experimental group using this individualized concept performed as well as, if not better. So it proved to us that The concept that the individualized approach to teaching is going to actually take the teacher out of the contact with the student, I don't really believe it's going to take place. In fact, I think that there's more one-to-one teaching than we've had in the past. The important thing is the student comes to you with a level of knowledge ready to receive information from you, instead of you having to sit and bring him up to that point where you're ready to communicate in that specific area that he's having trouble. They do much more preparation on their own, and I think this is a good point.
The final course to be discussed is oral histology, offered to students in the freshman year. Completion of a course in general histology is a prerequisite to oral histology. The student is expected to complete the 7 units comprising the oral histology course. These are development, eruption, and structure of teeth, as well as a histologic study of oral mucosa, periodontium, salivary glands, and the temporomandibular joint. The subject matter, which is highly visual in content, is presented in a variety of media formats. Dr. James Avery worked with Ms. Ruth Ashley in developing the course material.
We believe that we can get more information across to the student by this means than we did by our traditional lecture. For example, by putting together slide tapes or other media where the material can be reviewed or used by the student at a later period of time after the lecture, that we can also organize our material a little better and put it forth to the students, and also to put it into smaller packages than the length of a lecture might amount to. So that I think it's a little more efficient way of presenting material than we'd used with our conventional lecture before that time.
Okay. Does the student get all the information this way, or does he still attend lectures?
No, we firmly believe that the professor interaction with the student is important. So we have certain concepts that we're trying to get across. We do this by addressing the class in an open discussion type of approach. But the bulk of the material that we have had in the lectures before, we have placed in what we call a slide tape sequence. And by means of these units, the students can then look over the material and analyze to their convenience at a later period of time at a learning center.
You say then that this allows the student to review the material that's presented. Did the idea of the student progressing at his own rate enter into your decision to go to the individualized curriculum?
This came up a little bit later when we discovered that the students were using the available slide tapes not just for review but also for a preview, to view them before they went to the lecture so they'd know what questions to ask. And then I'm sure some students also used them and skipped lecture because they knew they were getting the information. A very few of the students could do this.
You remember, too, that we noticed that some of the students would review the tapes once or twice, and others a number of times, indicating that the individual level of use of the material was quite different.
Yeah, that probably reflected either their individual backgrounds in histology or maybe the fact that some learned slower or paid more attention the first time.
Right.
So some of the information or feedback you got from this original project then led you on to advance it in other areas then?
Very definitely. We were evaluating continually as to the success we felt of this technique or these techniques, because it wasn't a single technique. It was the use of a number of different approaches to try and present the same amount or unit of information for a week that we were doing with a conventional method, but in this manner to have the material available so they could use it at other times rather than classroom, and to have it available in more efficient packages than we had previously considered.
You mentioned slide tape, and I assume the bulk of the material then is presented on slide tape. Why is that?
This was a preference that we had, because we felt that the slide tape, and we defined a slide tape as a 15 or 20-minute capsule of information, as you remember, was a means which we could get a concept across. And we worked very closely with our educational resource people to analyze what the objectives were with each of these, as you remember. And as we decided on the objectives and presented the material, we found we were doing it in a lot more efficient manner than we did by the lecture.
And then we discovered that to amplify the histologic slides, we needed a great amount of artwork, and we were lucky enough to have some people available and develop much of our own artwork to go with it, to show development, to show sequences, like in the aging changes in teeth.
We found that we could divide the course into units, and each of these units would have adapted certain amounts of teaching material in the microslides or Kodachromes or electron micrograph notebooks or lecture material or, again, slide tapes, so that we could then, within that unit, present an organized outline of the material that we felt the student should be responsible to learn for that week. They can then test themselves by the questions at the end of each of these slide tapes, or they can further test themselves by going to the computer and getting the questions and answers back from the computer.
The next logical question then would be to ask you about evaluation and validation of the material presented.
At the very beginning, from the very beginning, we evaluated it to the extent of asking the students opinions of all the different features, all the different media that we use throughout the course. And they were extremely positive, especially about the slide tapes. They found those extremely useful.
As Ruth said, we feel that we have gained a great deal of organization, and we have the students' opinions by these analyses to indicate that they not only are getting the concepts that we want them to, and the reason that we are confident that that's true is that the students are averaging somewhere between 85 and 95 on these quizzes. So they are doing what we have asked them to do, and as a consequence, they receive a good mark.
These are some of the achievements in development of an individualized program of instruction at the University of Michigan School of Dentistry. The goals of the project are to increase the quality of instructional materials, to provide an opportunity for students to progress at individual rates of learning, a responsiveness to student needs, and to establish the school as a source of effective, validated instructional materials. These goals can be accomplished only through the cooperative effort of the faculty and instructional and media specialists. We believe that there are many methods and technologies with great value in instructional design and development, and that establishment of an individualized program of dental education indicates an exciting potential to accomplish significant advances in health science education.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.